There are several risk factors that come into play for the development of breast cancer. Many of them are modifiable, but many of them are not. So let's talk about the ones that are not modifiable first. First off, our gender. We are women, most of us, and that of course is our biggest risk factor. The second thing that we cannot change is our age. As we age, the incidence of breast cancer will increase, so that by the time we are 80 years old, the chance of having had or have recovered from breast cancer is about 12.5%. When you are 40 years old, the chance of having breast cancer is about 1.3%, or 1 in 68. So definitely age is a risk factor. The third risk factor has to do with your genetics. Family inheritance and genes. You cannot change your parents and your grandparents. We are dealt the cards we are dealt. But being aware of your genetic background and your family history can be very important. The age at which you start your menstrual cycles. We can't change that either. And the age at which you go through menopause. The younger you are when you start your cycles, and the older that you are when you finish, the higher your risk. And then finally, for non-modifiable risk factors, women who live in agricultural areas where a lot of pesticides are used may also be at increased risk for breast cancer. So what are our modifiable factors? How do we grasp this and take those things we can't change and decrease our overall risk by changing those things that we can? Well, the first one is, for women, if you're going to have a family, have your first baby before age 30. It definitely decreases your risk. And once that baby is born, if you breastfeed, it is protective. If you're using contraception because a baby isn't right for you right now, know that there is a very minimal risk of having increased breast cancer when you're taking the pill. But ironically, women who took the pill in their 30s and 40s subsequently have lower risk later on in life. So don't worry about it. Plan your family the way you want. Exercise. Women who are physically active have a much lower rate of breast cancer than women who do not. So keep moving. Weight. Today we've got a beautiful looking salad for lunch. Eating a good healthy diet and keeping our weight in the desired range significantly decreases our risk. Diabetes is related to that as well. So if you have diabetes and you keep your sugars under good control, your risk will be reduced.